and thanks for watching this webinar where we will provide you with an overview of the measures included in the AMA opioid change package and how they can be used in your quality improvement. For more details on other topics, do take a look at the other webinars, the instruction guide, and the EMR guide. The AMA Opioid Process Improvement Change Package provides an overarching framework to guide your practice in starting opioid process improvement. It is mapped against 4 high-impact changes, and it offers some potentially better practices along with suggested measures and tools for each of those practices. Now, we all know that measuring our improvement efforts is important, but the question is, how do you know that your changes are improvements? And of course, the answer is through measurement. So this webinar is walking you through the Opioid Measurement Toolkit. There are 3 types of measures that are commonly used in quality improvement. Outcome measures are often what is focused on as the most visible end result of a change. However, process measures are where we might want to start focusing our efforts when we're implementing a new process into practice. When process measures are collected over time and reflected upon, they allow you to quickly identify practices that work, that don't work, or give you an opportunity to course correct. Balancing measures inform whether there may be unintended changes elsewhere in the system. Ideally, using outcome, process, and balancing measures together as a family of measures will paint a fuller picture of what is happening when changes are implemented, but it's okay to start small. Most of the measures suggested in the opioid change package are process measures that contribute to outcome measures collected by the PCORI grant and captured by the evaluation team. These outcome measures are things like number of providers trained to prescribe opioid agonist therapy or number of patients on opioid agonist therapy. Focusing on process improvements and measuring them will help you to focus your effort to monitor your progress over time to ensure that your improvements are sustained and ultimately increase the likelihood that appropriate care is offered to patients at risk. So let's take a closer look at the measures. The measures in the change package have been transferred to an Excel tracking tool. This is available on the website. It's important to know that the measures and tracking tool have been built around the EMR, and we know that this is the most often cited barrier when it comes to measuring for quality improvement, so let's stop and talk about the EMR. So the EMR is a technical enabler of the patient's medical home, and it absolutely should be the hardest working member of your team. Investing time and effort into standardizing and optimizing your EMR will enhance the support of any complex population, including patients taking opioids. EMR-specific guides for this opioid work have been created and are available. There are other documents with helpful learning material and videos available as well to guide your clinic process work. So let's take a look at some of the key areas that we could optimize within the EMR to support process improvement. We could look at using follow-up reminders, standardizing data entry for better identification of patients using opioids, creating point-of-care reminders to flag patients who may be at high risk, creating lists of patients who may require more robust monitoring, printing those lists of patients using searchable criteria to track quality improvement progress, and of course, using the data from the EMR with your quality improvement team to identify opportunities for improvement or existing strengths. So the key message here is to take the time to ensure that the EMR is working for you as hard as it can. Putting in that overhead time will actually speed up and facilitate the rest of your process improvement. But let's get back to the measures. The first section is of those foundational pieces of panel identification processes and knowing your panel. These measures will actually help to establish denominators that will be used to examine the rest of the data. Next, we begin to segment the panel into subpopulations. The more information you can get here from the EMR, the more you'll know about where to focus your efforts for maximal impact. But importantly, if none of these suggested subpopulations seem like a right fit for you, there is an opportunity to define your own measures. So absolutely choose a population and a measure that is meaningful to you and the clinic work that you are doing. Finally, once you've selected a population, you can select 1 or 2 measures that are relevant to the changes you are implementing, again, making them meaningful to you. The next webinar we have is a detailed walkthrough about how to use this tracking tool, so please check that out. I will go through a quick example for you here to show you how it all works. So in this example, the team has entered their panel data. They've entered data for the suggested subpopulations. You can see that the data are automatically graphed, And in this example, the team has had a discussion and decided to focus their process improvements on patients with opioid use disorder. They select their subpopulation and choose to focus on using a conversation checklist with those patients and begin to track their data over time. Again, the graph is automatically populated. The team is able to use the data to raise questions and have discussions at their team meetings. Once they are confident that they have implemented a change that is an improvement, that it's sustainable, they can choose another population to implement the same process improvement, or they can choose another care management strategy with the same population using the same tracking tool and the same technique. So to put it all together, we start with our foundational panel identification processes to ensure you are making improvements for your patients, the patients with whom the physician and care teams have relational continuity. We can then identify a population that we are focusing on, in this case, patients using opioids. Next, we identify a target population. This helps to break down the change into incremental steps or bite-sized pieces without having to tackle a large population all at once. So in this example, we're looking at patients with opioid use disorder. Next, we select a process improvement and we measure it. This could be care planning, use of a conversation checklist, or in this example, use of an assessment tool. Ultimately, this aligns with the goals of the grant in supporting patients to be appropriately managed and increasing the number of patients on opioid agonist therapy if that's applicable. Now, we know that clinical care is not often this linear and this simple, but that's all the more reason why it's so important to measure. There are so many factors that influence whether or not a change is an improvement or whether it's sustained. And so measurement will help to keep you on the right track. So the measurement toolkit for the opioid change package does include that Excel tracking tool, an instruction guide, several webinars, and EMR guides to help you. I hope that this has given you an overview of the opioid change package measures. Please see the other videos if you're interested in learning more about how to use that Excel tool, if you may be interested in an opportunity called the Demonstration Project, or if you'd like to hear from Dr. Brad Baylor about why measuring offers of care is so important. Thank you.